Hi, I'm Femi OK. You're watching the stream. On today's episode, I'm going to take you to Indonesia, which is currently recording the highest number of COVID infections than anywhere else in the world. I want to start with a personal story and a little 10-year-old boy. This is Vino. Last week, Vino lost his mum and his dad. His mum was 5 months pregnant. She died last Monday, and then the following day, his dad died of COVID. That's Vino's family story. But across Indonesia, medical professionals are also struggling to get a handle on the COVID-19 Delta variant. This is a program about them and what Indonesia is going to do about that.
Di Jawa dan Bali yang dekat dengan resource yang begitu banyak.
In Java and Bali, where they have a lot of resources, the situation is still chaotic and cannot be handled well. What about the people on the other islands? Our resources are not as abundant as Java. The hospital suggests 40 hours a week, but that doesn't work because we are short on people. So now we work between 80 to 100 hours per week.
Yesterday, one of my colleagues, she's a doctor. She passed away because of COVID-19. And it's just so sad, it's just like losing a comrade in a battle. I think it's hard because I kind of feel like we are fighting this whole phenomenon with all my friends.
What would you like to know about India's COVID crisis? What would you like to share about Indonesia's COVID crisis? Excuse me. YouTube comment section is right here. Do be part of our program. Anytime you have questions, I will do my best to fold them into our conversation. So let's meet our guests. We have Tiara, we have Dr. Budiman, and we have Jessica. Tiara, welcome to the stream. Please greet our international audience. Tell them who you are and what you do.
Thank you, Femi. Hi, everyone. I'm Tiara Martias. I'm a health systems researcher based at Gajah Mada University, but during COVID, I'm based in Jakarta. It's good to meet you all. It's 2 a.m. in the morning in Jakarta, so good morning.
That's commitment right there. Dr. Budiman, thank you so much for getting up early, staying up late for us as well. Appreciate you. Introduce yourself to our global audience.
Hi, Femi. Good morning, everyone. I'm Dr. Budiman. I'm an epidemiologist and researcher on pandemic in Griffith University. Now I'm in Brisbane and almost 2 years now, and still cannot go back to Jakarta, but still helping the government to dealing with the pandemic.
We'll come back to you in just a moment, Doctor. Hello, Jessica. If you've been watching Al Jazeera, you'll know Jessica really well. Jessica, just remind our audience who you are and what you do.
Hi, Femi. Good morning. Good evening, everyone, wherever you are. I'm part of the Al Jazeera Asia Pacific team, and I'm the correspondent based in Jakarta.
Jessica, if you were filing a story today, what would be your headline? What would be your lead? What would you say? This is what the world needs to know about Indonesia right now.
Well, it's very difficult to say because there's so much happening, and it's sort of just been this relentless cycle of news where there are so many various angles, so many things that we could focus on any given day, because it's not just about the immediate health implications, but beyond that, what happens to the families who have lost their only breadwinner? What happens to the children who have lost both their parents? And so this is a story that is very much one that keeps us busy because there is so much to explore, and I don't know that we'll ever have the time to do all of it. And then what's worth keeping in mind is Indonesia's geography, that what happens in Java, what happens in Bali, does not represent the whole of the country. And so we need to be mindful of what's happening, not just here in the capital, but across thousands and thousands of islands. So it is difficult to say what we would focus on any given day. It could be vaccinations, it could be the impact on children, but there's always something that keeps us very busy.
I'm just going to share on my laptop, Jessica, this image here of Indonesia, because there's 6,000 islands, as you say. So this is a vast area that we're talking about, not just Bali that people may know. So I want to bring you in, Tiara, here, because there are lockdowns, and lockdowns have happened. There have been multiple lockdowns. what is the lockdown situation right now and how effective are they being?
Since last year, we have had around 23 lockdowns at different scale and also at different scope. The current one might be one of what we like to say as the strictest one, but it's not really effective. As we can see in streets in Jakarta, yes, some activities have slowed down, malls are closed, but a lot of people are still flocking around, and that doesn't help really with the transmission of COVID-19. A lot of it are due to economic reasons, but also the inefficiency in policing the community.
Dr. Budiman, I deliberately didn't start the show with numbers. And this is the number of people who are being infected. This is the number of people being tested. Because it's very difficult to do that for Indonesia. Actually, it's difficult to do it for any place in the world because we don't always know who has been infected. Did they even come to the hospital? Were they tested? Can you explain what the problem is, in particular for Indonesia, for getting a grasp of the true number of people infected and true number who've passed away?
Yeah, this is a classic problem for Indonesia since the beginning of pandemic, because then we don't have enough capacity to do the testing. Actually, in the beginning stage, actually we should do this one, but the testing and tracing capacity. But then now the complexity of the problem is already huge enough, and as we see, Indonesia has many islands and a huge population, around 270 million, and the disparity of health system among the island is also that's a remain problem, especially out of the Java island. And as I should say that if we talk, Femi, I should say to the world that if we talk about Indonesia, then we will see different pandemic curve among the island. We have, let's say, 5 big islands. So currently, what happened in Indonesia is contributed by only Java, Bali, and Madura Island. That's contributed the peak curve of Indonesia.
Dr. Budiman, I'm assuming because that's where the population is concentrated on those islands,
yes.
Correct? Yes. Okay.
Yeah, and if we talk then about the next step, then if we don't learn from what happened in Java, then another serious situation will happen in Sumatra and even in Papua. Even they already started now, and the problem now is about the testing capacity, because then without this enough intervention on testing, then we don't have enough data and we don't have enough to know what is the real situation.
You actually just don't, like most of us around the world, if you don't know who's infected with COVID, how can you tackle it? How can you even keep separate? Jessica, go ahead.
The thing is with what you were talking about with, why testing is so important and what Dr. Budiman referred to in terms of not really knowing the scale of the outbreak because testing has been so consistently low, that the impact on the ground and what we've seen with our reporting is you have these field teams of sort of roving medics who are trying to capture some of the overflow of patients who can't get into the hospitals. And increasingly, some of the people that they're monitoring, what they have told us is they've sort of grown sadly accustomed to finding people dead in their homes, because in one sense, people never got the opportunity to speak to a doctor, and other people may have been sick with some sort of symptoms but never had the opportunity to be tested for COVID-19. So what that means is so many people are dying, and I don't think we'll ever have a sense of how many people we lost to this current surge or the outbreak as a whole, because we never really had the testing mechanisms that we needed.
Let me just go to YouTube guests. I have so many questions for you. I'm going to utilise you while I have you. This is Leslie Wheeler. Tiara, I'm going to put Leslie's question to you. Leslie's interested in how the government is helping the very poor, since so many things are closed. The financially well-off are fine, but what about the poor, Tiara?
That's a very good question, and that's, I think, relevant not just to Indonesia, but a lot of low middle income countries facing this pandemic. The government has set up some social assistance programs, but the number of coverage and also the amounts of money being given out or direct, for example, for food supplies and stuff is very minimum. For example, one of the largest programs has been subsidizing one family for around $30 to $45 per month. It will not be enough to subsidize for the loss of income faced by a lot of people working in the informal sector, which is around 70% in Indonesia. And we have also seen a rise in unemployment by 1.8 million people during the COVID-19 pandemic.
Oh my goodness.
And yes, and that's a lot to do with also the decentralized system in Indonesia, where we have the central government, the province, and the district government. So some of the districts are doing well because they might be able to mobilize extra funding or convert hospitals and more support to the people. But then it also means there are a lot of other provinces and districts that cannot cope due to limited funding or weakness in the governance system.
I have two thoughts for you. They're basically the same idea, Doctor. So on YouTube, the religious people of Indonesia don't believe in COVID. And then this thought from a video comment that Jessica helped us actually drill down into. So we're getting a sense of how the people of Indonesia are dealing with the whole idea of COVID-19. Have a look, have a listen, Doctor, and then react off the back of it, please.
Misinformations like hospital will enforce COVID-19 positive status to any patients, or drug interactions will kill patients instead of virus, already make people hesitant to see the doctor or to go to hospitals. Some of the people that believe to these misinformations died because getting late health interventions. We are still working very hard to counter these dangerous misinformations.
Yeah. This is something that, it's appear in almost 16 or 17 months. And one of the reasons is also about the communication strategy that first, in the early stage of this pandemic, governments don't play the situation. And that's impact very, very much. And then even the government tried to fix the strategy, but then still the miscommunication and the misinformation already spread among the community. And the other factor also is because how the quality to dealing with the pandemic is not strong enough and it put the country in a level of control in good. I mean, like that, because the testing not enough, and then now we saw many case infection in hospital, and also the number of death case among the community is also increasing. So the panic in community now is rise, and it's easy when people panic. The misinformation, the conspiracy theory is easy to spread, and this is the situation is happening in Indonesia. And of course, there's a responsibility for all to deal with this. But then again, without strong intervention by the government to deal with this pandemic, like again, but testing, because the testing should be like free for them. So it will also minimize their burden, especially in for the low economic status, and also then we have to give these counter the misinformation to use their local language. Indonesia has many languages. Then we have many communities. Even then, it's not only used like social media, because the misinformation spread. It's not only by this media, social media, but it's among mouth to mouth. And this is the complexity situation in Indonesia. That's why, based on my 12 experience working for government, we use this community local leaders, and we use the local context to deal with the local issue also, then local languages. And this is something that we have to use now.
Let me share with our audience this picture. Jess, I'll come to you in just a moment. Let me just share this picture because we started our entire discussion with medical professionals talking about how strained they were. This is a car park of a hospital, and they are using the car park outside for hospital beds. Another challenge right here. This comes from Louise Hunt, who had a question for you, panel. Oxygen supplies, health workers, vaccines are urgently needed in provinces. When is the international community going to step up to properly respond to this crisis? Before I put this to you, guests, I want you to have a listen to Alif, who talks more about this problem with oxygen and not having enough, and then when it is available, the price gouging. Have a listen.
In Indonesia, there is no producer for the oxygen tank, all of the importer. The second challenge is how to refilling the oxygen. Every day, our volunteer is join with the community, join with the people to queue at the depot, at the refilling station. They brought about maximum 2 tanks because the refilling station doesn't allow the people who brought over the 2 tanks. And the third is about the regulators of the oxygen. The regulator set price now is about 300% higher than the normal situation.
Tiara, would it be fair to say that a government 16 months into a global pandemic should have a source of oxygen and should be able to control price gouging of oxygen tanks? Would that be a fair critique, Tiara?
Definitely, and it didn't just happen with oxygen supply, but we also see it early at the pandemic where PPE masks are like 400% higher than it should be because people are hoarding the supplies and taking advantage during the crisis. And what else beside a strong government and a strong enforcement of the law, really, to help ensure that the distribution of these supplies are going to places where needed. But also, like Pa Alif said, the supplies are in a very short supply anyway. And I think it's a good question. We should see a more hand-in-hand collaboration across nations in facing this global pandemic.
Jessica, you're one of the few English-speaking reporters who's still actually in Indonesia telling this story. So when one of our viewers says, when is the international community going to step in? When are they going to help? What's your response?
I mean, I think we have seen some assistance already from Singapore, from Australia, from the US, and obviously that's welcomed. But the reality is that so far that hasn't been enough, that people are struggling. And a doctor that we spoke to recently said to me she never imagined that she would be in a situation where she would have to ask patients to BYO oxygen to come with a tank because the hospital may not have enough for them. And we spent a bit of time in our reporting outside an oxygen store talking to some of the people trying to buy oxygen for their loved ones. And some of the people in that line were children. And it is like what you just referred to, Femi, 16 months into the pandemic, why isn't this government, why didn't they do enough? And I think the response so far from Indonesian authorities on the central government level has been very much reactive rather than proactive, waiting for an oxygen crisis before they address the shortages, waiting for things to really spiral out of control before bringing in restrictions. Everything is sort of waiting for the next bad thing rather than seeing what happened in India, what has happened in Brazil, and trying to anticipate the next point in the crisis.
Doctor, I have this thought here. Oh, sorry, Tiara, you go ahead. You go first, I'll go second. Go ahead.
Just wanted to add that the community participation and collaboration has been vital, apparently, in Indonesia, and I'm sure in a lot of developing countries and developed countries as well, where people are really hand in hand and not just ensuring that people have, or at least try to have access to oxygen supplies, but also donating plasma convalescent, for example, or just getting drugs to whomever need it. And that's unfortunately it's a tragic thing as well, right? People are taking care of people when the country needs to also take care of its people. And that's, I think, when we have another pandemic, which we certainly would have, one thing to make sure is every country should have enough supply in mitigating and handling their COVID-19 or other pandemic, like what Taiwan, for example, have been preparing for the last 10 years.
Mm-hmm. Just off what Tiara was talking about, the volunteer culture here is, I think there are very few things to be optimistic about at this point, but really seeing this volunteer culture in action it's very admirable. And it's not just people trying to provide food for their neighbors who may have lost work. It's beyond that. People who are working on a volunteer basis as undertakers, collecting dead bodies, cleaning them, on behalf of the families who may not know the processes or may be too sort of shocked and traumatized to do that themselves. So can you imagine, being in a community and volunteering well into the night? We spoke to a woman who volunteers from midnight to morning, basically trying to assist these families. And that's something that I think most countries wouldn't have that strong volunteer culture that Indonesia has. But also on the same note, perhaps most countries wouldn't need that culture of volunteerism that Indonesia has.
Dr. Budiman, I want to share you this thought here from Gideon. Gideon is on social media. He knew we were doing this program. What is the leadership planning to do in real time to alleviate the situation? Is there a measurable preventative strategy to curb further loss of lives? Dr. Budiman, you handle that one, please.
This is what Jessica already mentioned. The community role is very important, and Tiara also mentioned about it. Because the problem for Indonesia now, the complexity of this pandemic situation, it's not only impact the health sector, but the biggest. I already mentioned this in early of pandemic that we have to prevent in Indonesia context. We have to prevent the complexity of situation when we have to choose between health and economy. And now Indonesia in this situation, the complexity of this situation, then the government then there's no option that they have to choose the economy, because then the strategy that they choose they had before is not strong enough in preventing the worst scenario will be. And now I already give advice to the government that for Indonesia to maintain their strategy and prevent more surge case in hospital and also death number, they have to strengthen their testing and tracing capacity.
Testing.
Yeah, again, and for Indonesia context, they have to do this visitation, home visit, because 80 to 85% of cases is among community, and otherwise we will see more dead number in community. And now we already seen even out of Java now, and I have a family in Sumatra now who's sick with the COVID-19. It's not easy to get the medicine, and even in Lampung now. And I had my children just passed the isolation program last week. 4 of them got COVID-19, and it took me like 3 days to get the medicine.
Thank you, Doctor. You bring us to a close for this part of the conversation on a personal note, which is how we started. We started with a little boy's family, and we ended up with Dr. Budiman's family and his story. Thank you for sharing that. YouTube, excellent questions. Let me share here on our laptop how to stay on top of the story from Indonesia as far as COVID-19 is concerned. Dr. Budiman, this is Tiara, and our very own al-Jazeera correspondent, Jessica Washington. Thanks for watching, everybody. See you next time. Take care.